Are statins effective for MASH patients, especially those with advanced fibrosis?
I'm glad you asked that because I'm going to change the question a slight bit. Because, when statins were first developed 30 plus years ago, there were very grave concerns about liver toxicity. Now, those have almost all been dispelled. They've almost all been dispelled. And there are numerous papers out there for many years that statins are safe in patients with chronic liver disease. They're safe. And I still get questions about once a week or once every 2 weeks from doctors. Can I give a statin in this patient? They have a liver problem when they have fatty liver. And the answer is always yes, unless the patient has a known reaction to statins, which is very, very rare. I think in my entire career, I've seen one or two patients that have had a liver toxicity from a statin. And it's one of these are amongst the most commonly used medications in America for decades. So you can use statins. And keep in mind, the patients with fatty liver die most frequently from coronary artery disease or other cardiovascular problems. And it is very important to treat their cholesterol problems appropriately. And statins are often thought to be the best medications for that. Now, do statins specifically help the liver directly? And that has not been demonstrated yet. We don't have data that show that statins specifically help the liver. Now, we do think helping cholesterol and triglyceride problems help the liver. And yet, to my knowledge, I'm unaware of studies that demonstrate that statins specifically help the liver in patients with fatty liver. But it still helps patients who have cholesterol issues. And, an aggressive therapy with statins often is a very good idea for patients.
When it comes to off label treatment, should metformin be considered for non diabetic patients with MASH given its potential effects on insulin resistance and inflammation?
Yeah, that also is a great question. Metformin was thought potentially to help people with fatty liver. It was one of the first drugs that was really investigated in fatty liver years ago, because from a theoretical standpoint, it would seem that it could help. It helps type 2 diabetes mellitus by helping with insulin resistance, and these again are thought to be drivers for fatty liver. And yet, metformin really never demonstrated efficacy for the fatty liver part. So metformin is not recommended for treatment of fatty liver. Now, if somebody wants to use metformin for type 2 diabetes mellitus, you can for that, but we don't think it actually helps the liver part.